We as a system have been working in this area of safety and quality for a long time. What we have done over the last year and a half is basically re-energize and reframe the priority of our healthcare system.
Baylor Scott & White Health is the largest not-for-profit healthcare system in Texas. We have 50-plus hospitals. We have 45,000-plus employees.
And so I think we're put in a unique position to really see what can we do as an integrated system that changes healthcare for the better.
So we talk about zero harm in almost every conversation. We talk about it as we look at our quality measures. We talk about it on our CEO calls. We talk about it in our huddles. We are constantly discussing zero harm.
So in every organization across Baylor Scott & White Health, they're having safety huddles daily. And they may escalate something with some medical equipment, something with electronic health records, something about the environment. We take those huddles and we continue to escalate until we get resolution. The resolutions that are communicated back down to the same staff that escalated the concern to start with. So that closes the loop that my voice matters, that no matter how small the potential risk is, it needs to be spoken about during safety huddle.
One of the things that we've done that is applicable across the system is really look at behaviors.
When we do root cause analysis and we drill down to why an error happened, when communication is part of that root, we call it out. Historically,
there have been people in the room that may not feel comfortable speaking up.
We talk about escalation during orientation and we give them the text to say, I need some clarity. And with that, all of us understand that word is connected to potential harm.
What this does is it gives us a shared language where we can all understand in complete clarity what we're striving for.
The answer is to say, what is that issue? Let's see if we can resolve it. If it turns out it's not an issue, then the answer is to say, thanks for bringing that to our attention. Turns out it's okay. We can continue to proceed, but it's good that everybody gets on the same page before we do that.
Therefore, they feel empowered to stop the line in case they see something that is not good.
Great catches are where people have identified and spoken up about a potential problem before it's reached the patient. We tell those stories about what they did. At each campus, there's a different recognition process in how they recognize those individuals locally as well as at the system level. We tell those stories about what they did to highlight those individuals who've spoken up. That's great, but really it's to communicate and encourage and empower everybody.
All of these people are very bright. It will be a big mistake if we don't tap into their creativity and the knowledge to tell us what to do.
One of the exciting things I've seen that Baylor Scott & White has done is it's not a patient safety goal just for the bedside providers.
If you think about zero harm, it really underscores everything that our values stand for. It's a natural outcome of serving faithfully, never settling, being in it together, and acting honestly. We have an opportunity inside Human Resources to help solve a problem that a caregiver is facing. And if we can do that and they can get back to taking care of the patient, then I have absolutely helped improve the patient experience.
People are empowered by this, they're invigorated. I think we're in a better spot today than we have ever been.
Our harm scores are decreasing, our never events are decreasing, and at the same time our service is increasing.
Blessed to be part of an organization that's been committed to this for a long time, so I don't know how you start exactly from zero, other than to say it really just takes one champion to start communicating this.
Don't confuse the message. Keep it simple, never waver, build it into everything you do.
It's not just about a metric that comes out on a scorecard. It is every day mentioning harm in your vocabulary. It is telling the beautiful stories of great catches.
So it's a combination of things, leadership, communication, cultural changes, and reframing the importance that this has for our healthcare system.
you can get lost when you're talking about percentile rankings and how's everybody else doing. But when you say 0, everybody knows exactly what that means. Everyone knows exactly how to get there. And so then you have to inspire your staff and draw on what they know are the risk areas and what they can do to help us reach that ambitious goal.